Thank you for being with us. I'm Mary Yanez, Director of the Senior Adult Program at the El Paso Community College. And of course, this is mature living. We want to keep our families healthy, our women healthy. The whole family gets involved when the mom or the grandma or somebody gets breast cancer or any type of cancer. So we want to make sure that we advise, that we provide services and bring you information about that. So we've invited from the Hospitals of Providence, Dr. Salvador Saldivar, and he's here to talk to us about genetic testing. Can you imagine that? So let's see what he can share with us and how we're going to learn. Thank you for being with us, Doctor.
Thank you for having me.
Tell me a little bit about yourself and your specialty, what you do.
So I was born here and did my training elsewhere. I'm a GYN oncologist with the RGU Cancer Center. We're in REMCON, 7420 REMCON, and we're also in 1400 George Dieter. Yes. And I do most of my surgeries and work at the Hospitals of Providence. Good.
And the topic, genetic testing, that is like, wow. Mm-hmm. Tell me about.
Yeah, and in due time for Breast Cancer Awareness Month this month.
Yes.
So genetic testing is not what we usually see on TV with Ancestry.com, the 23andMe. The new one, it's called Color, that tests breast cancer, the breast cancer gene.
Okay.
Now, those tests match your usually saliva with DNA matches, and then they give you information about your ancestry or some personal medical history.
Yes.
The type of genetic testing that we do in our office is to detect mutations in the DNA that predisposes patients to certain types of cancer, namely breast, ovarian, colon, and endometrial cancer. Those are the more common hereditary types of cancer that we treat and see.
And so people can go in just for this test, and so that they can find out if they're predisposed or if they need to take care of themselves a different way, change your lifestyle or something for prevention. And so who should get tested?
So when we see a patient for that particular, just for testing, we ask them to fill out a comprehensive family history questionnaire.
Yes.
And that should be part of the medical intake in all clinicians' office.
Yes.
Just like your medical history, your allergies, and things like that. Once we diagnose a patient with a hereditary cancer, or there's these red flags that arise as part of the family history, then we counsel them and then set them up for testing through blood or saliva, depending on their insurance coverage and the company that we use.
Yes. So interesting. I know there's probably a procedure that you follow, a process, right, of what you do when your patients come.
Yes.
In my case, there's not much cancer, but my brother did pass away with cancer, and he's the only one. So I don't know, is that something that I should be thinking about?
Well, we would then ask what type of cancer your brother had, at what age. Age is very important. The younger 60. The age, the younger the age, the more at risk you have. For example, a breast cancer or a prostate cancer in a patient that's 30 years old is different than if you get that type of cancer when you're 80.
Okay.
Yeah, there's genetic or hereditary types of cancer, and then there's more of what we call sporadic, or they just happen as a result.
Just happens. And you could be the first. You never know, right?
That is correct.
So walk us through the procedure.
So basically, after the family history intake, and again depends on your insurance coverage, we use different types of companies. We either draw their blood there in the office or a simple saliva sample.
Mm-hmm.
Yeah.
What if you find that after the test that I'm high risk or that the patient is high risk?
Yeah. So there are three basic results you can get after you get the test. One is you're negative for that mutation. In other words, you don't have that mutation. However, if you do have a high-risk cancer or a cluster of family members without having a positive test, then we still follow you closely.
Yes, good.
There's another one called a VUS. It's a variant of unknown significance. What that means is just a variation, just like age. I'm sorry, height or eye color, and those get set in a data bank. And if they become associated with a certain type of cancer, then they're changed to a harmful mutation.
Okay.
And then the last is a positive mutation. Once you test positive for a certain mutation, let's say because it's breast cancer month, breast cancer, then we set you up with either a very strict cancer surveillance or set you up with a surgeon or a plastic surgeon to have a preventive mastectomy, which some women undergo.
Yes, very interesting. I know I talked a little bit about lifestyle a little bit ago, but is there something that we can do to minimize the risk?
I think any lifestyle change for any type of cancer is for average risk, healthy diet,
Okay.
no smoking, a self-breast exam for women, at least quarterly,
Okay.
and clinical breast exam, and then your annual mammogram starting at age 40.
Sounds pretty simple, right?
Sounds pretty simple,
Yes.
yeah.
And so if we do that, then we're preventing, we're helping to
golden,
minimize.
yes.
Yeah. And lastly, the services. What services are available for women, and then we want to give your phone number where they can reach you.
Yeah, so make sure you're plugged in with a physician. First of all, anywhere
Yes.
between a family physician, your gynecologist,
Yes.
your internal medicine doctor. The basic annual mammogram, a clinical breast exam, and if you follow a self-breast exam quarterly, you'll be
Is
good.
there a particular age where women neglect to get their annual mammogram, and then as you get older, you have to do it more often, or is there something that you found?
I think in our population here in El Paso, and I'm from here, it's basically when they come in for the first doctor's visit, whenever an illness
Yes.
becomes apparent, and then that's when all the surveillance and the preventive measures start.
Okay. Boy, you've just left me with a lot of more questions, and I know maybe our viewers have the same thing, so they may want to get a hold of you, Dr. Saldivar. We do want to invite you back as well to talk about other things that we need to help our families and our women. Give us your phone number.
225-2060.
Great.
Yeah.
Is there
We'll be
something
happy
you
to see
didn't cover that you want to say lastly?
No, just make sure you see your doctor annually. Get those mammograms starting at age 40.
Will do.
Yes.
And you will do as well. Thank you, doctor. Thank you for being here.
Thank you.
Okay, we'll be back with more guests, and we appreciate your time. I know you're busy.
Thank you.
Thank you for staying with us here on Mature Living. We want to continue our conversation about the Ombudsman program with the Area Agency on Aging. And so the managing, let me see if I can get his title right. The managing local ombudsman is Jorge Soto, who has a master's in social work and, very dedicated. And he's going to tell us all about what is an ombudsman.
Yes, thank you for having me.
Thank you for
Mary.
being here.
Yes, an ombudsman, it means an advocate for the people, and in this case for the elderly.
Yes.
We are, as I work with the AAA, Area Agency on Aging, we are advocates for residents who live in nursing homes and assisted living facilities.
Okay.
We provide any kind of assistance for the resident, explaining any problems they might have for care, quality of life, and any of the residents' rights.
Wow, that's interesting. And sometimes you need somebody to advocate for you if you don't have family members living or in the city. And so these ombudsmen, are they volunteers? And this is a program that has been, I guess, around for a long time with the Area Agency on Aging.
Yes, it's been a while. I've been here for almost 3 years, being the managing local ombudsman, and under me I have volunteers. We certify volunteers by the state of Texas, in which I am also certified by the state of Texas because I also go to nursing homes and deal with more bigger problems.
Yeah. And so do you advocate for the seniors that are the residents, but then you also work out issues between management and
Family.
the resident and
And with the resident and family, yes, because sometimes residents doesn't have a voice.
Yeah.
So we are that voice for them, and they don't have a family. So that's why our volunteers go every month to visit them and ask everybody how their quality of care doing, if they're doing everything okay. Is the facility providing the proper care for the resident?
If you walk into a facility and it smells like urine, for example, that's a flag.
Oh, definitely.
Yes.
We ask, why is it smelling this way? And then they'll take care of it right away,
the situation.
Fortunately. Yes.
Because you are representing the state of Texas. You're trained.
Yes.
And so to be an ombudsman volunteer, it doesn't have to be somebody that's employed with the Area Agency on Aging.
No, definitely not. It could be anybody who wants to work with the elderly, who's been, has a patient, wants to work with them, wants to help them. You don't need any degree or any other things such as that. We do provide training.
Yes.
The certification, it consists of a 36-hour training.
Okay.
Supervision and ongoing training, because we have, after you're certified, we have continuing education. They have to have 12 hours per that year. Okay. But I'm always supervising, providing guidance, providing assistance with all my volunteers.
And so your volunteers go to the various nursing homes. How many are there in El Paso?
There are about 17 nursing homes right now, and about 40 assisted living facilities.
Yes.
So we try to go, we have assigned volunteers to every nursing home and assisted living facility.
What have been some of the satisfactions that the volunteers get from representing and or from advocating actually for residents?
Meeting the residents, knowing that they are helping them, advocating, helping them, that they're providing that proper service. And it could be about neglect, abuse, financial exploitation. And it could be about their activities, about their therapy. It could be about anything, not having the proper diet. Because sometimes they do forget that. It's very important to know which residents are diabetic and which are not.
Very good.
And
also, if you have teeth or if you don't have teeth, you've got to be pureed.
Pureed food, all those things.
You don't give somebody a steak that.
Exactly, and a lot of them complain because they say, well, they're not giving me the proper food. So we do direct them to the people who they need to talk to. Those that they have a voice, we do guide them.
It's an amicable, friendly exchange.
Exactly, because we also work with the staff members. And we would like to have that good relationship, because if they help us, we help the resident.
Okay. And one other question I wanted to ask, you mentioned resident rights.
Yes.
Are there a certain...
Yes, there's certain rights that the resident have, like, for example, being treated with dignity and respect.
Okay.
Having their own, who they can talk to, their own visits, family who can come, who can they go, things like that. What kind of activities they might like to do.
Okay.
For them to be respectful to them.
Yes.
What time they would like to wake up, what time they want to get showers, things like that. Those are rights for the residents to have privacy. That's very important. They have the right to privacy. Confidentiality is very important with us. We only work by the residents' consent.
Okay.
If they want us to help them about an issue, we do help them, but we don't say anything to the staff members.
Okay. And how often does an ombudsman generally visit their assigned...
Every month.
Every
month. It could be 2 to 3 times a month, but every time I have somebody visit a nursing home or an assisted living facility.
If you want to be like an ombudsman, an advocate for seniors and have an assigned nursing home or assisted living, do they, part of their training, do they need to have a background check or?
Yes, we do a criminal check and a screening on conflict of interest. Because sometimes volunteers come and they have a family member working in a nursing home or in a foster home, and that can create conflict.
Okay.
So we want to make sure that we don't have that, and they have to also have transportation.
Oh, yes.
That's also very important because we have nursing homes and assisted living all over El Paso.
Ideally, how many volunteers are you wanting to fill positions?
Oh gosh.
How many would you like to have, and then how many do you have? And do we have a lot of openings?
Well, we have about 6 volunteers right now. I don't have a number set as far as you're going to have 15 or 10. We can have as many as we can to fill those nursing homes and assisted living facilities.
Also, Jorge, where can they call you if someone's interested in being a volunteer? Let's say somebody recently retired and they've done all the housework that they wanted to do, or you want men as well, right?
Of course, yes.
Males and females.
Yes.
Or they've painted the fence 10 times, and now they want to do something that's meaningful.
Yes, yes.
Where can they call you?
They can call the office at 915-533-0998, and they can direct to the Ombudsman.
And I know where's your location?
We're located at 8037 Lockheed, Suite 100.
Near Hawkins in Montana?
Between Hawkins and Airways.
Okay, very
Yes.
good. And so we've given your phone number. You're part of the Rio Grande Council of Governments Area
Yes,
Agency on Aging.
Exactly.
So glad that you came by, because I hope you get a lot of calls.
No, I
That'll
hope
show
so.
us that what people are watching,
Yes.
and that you all are wanting to stay busy and help seniors in this community. Thank you so much.
Thank you for having me.
Okay.
Appreciate it.
We want to continue our conversation talking about insurance, talking about enrollment. Right now, it's a very important time of the year between October 15th and December the 7th. And so we've invited Ana Casillas, who's the owner of Medicare Plus, which are independent insurance company that is talking to clients and helping them to find just the right fit of insurance that you may need. Thank you for being with us, Ana.
Thank you.
You come and visit
How
us
are you?
every year around this
Yeah.
time.
Well,
Tell
it's
me-
important time.
It is an important time. Tell me, this enrollment period, why is it so important, and what should people be thinking about right now?
Well, it's from October 15th through December 7th. It's the annual enrollment for people with Medicare. This is the time when they can review their benefits. If your needs change, the plans change. Some of the benefits, they change. So you have to review them, find out what are the changes, and if there's anything else that you want or that you need to be covering of your needs.
If last time you got dental, and maybe this time you need eye care or some services with your sight, then you look for a plan. You help the people look for the right plan.
You know what? The plans, these when you have Medicare covers hospital, medical, and prescription drug plans and prescriptions. But then these plans are called Medicare Advantage plans. So they give you additional benefits than the hospital and the medical and the prescription. And sometimes they give you dental and glasses, or they give you gym membership, or they give you over-the-counter, they give you transportation. There are a lot of extra benefits that you can find and can help you throughout the year.
Do you work with all of them to find the right fit
Yeah.
for the individual that's going to come to your office, and they're going to say, "Okay, let's see what you have. Let's see if there's any changes in your health or any changes in your doctors," because sometimes doctors drop off of different plans.
That is precisely because we actually certify with all the companies, because at the end of the day, what we want to do is work for you. We represent the companies, but each plan, it's going to have a better fit for you than other plan. There are people that require, for example, certain medication.
Like
and you
for
can find-
diabetes, diabetics?
Insulin, for example. That is a perfect example. There are plans that the insulin, they're expensive, and there are other plans that are promoting, or it's a special plan for people with diabetes, and insulin would be maybe $0 or $9. So it's really up to the really reviewing your needs so we can find the best fit for you.
Yeah. And so during this period, at the end of December 7th, do these plans also have some savings programs or Medicare savings?
Well, do you know what? It's simple. It's good that you mention it because there are subsidies from the state, from the government, either with federal or state money that are for people with Medicare. They're called Medicare savings programs. These Medicare savings programs, what they do is for people with low income. Some of them, they give you subsidy for your prescriptions. Some of them, they pay for your Part B premium. Or some of them, they pay you for that 20% that Medicare doesn't cover.
Yes.
And there are a lot of people that qualify for them, but they don't know how to apply or what are the limits, and we can help you. We can guide you with that.
Very good. Now, we mentioned incentive plans earlier as we were talking before the show. What are these examples of incentives?
Well, it's what we're talking for. It's there are plans that, in addition to the medical services that they provide, there are some plans that, for example, you need hearing aids.
Okay.
Medicare doesn't cover hearing aids. Some of them they cover you for hearing aids up to $3,000, or they have dental. They can help you with dentures,
Yes.
or with just comprehensive dental. They give you the transportation. They give you all these
Different,
additional benefits
I see.
that really can help you throughout the year.
So what happens if you don't review it after December 7th? Why is this period so important?
Because it's only through this time when you can review them, and it'll be effective the first day of the next year. And that's the plan that you usually have to keep unless you have a special election. So annual election, it is from October 15th through December 7th. And then from January 1st through February 14th, it's called this enrollment period. It's like, for example, somebody enrolled during the annual enrollment, and then they got all worried. It's like, no, this plan might not be working fine. It's like, I want to go back to original Medicare. They can go to original Medicare through that time. And then the rest of the year, it's called a special election period. It's for people that maybe are retiring for the first time. They are moving to another city, and they're going to need to change a plan, or you have low-income subsidy, or you have Medicaid. There are different.
So actually, the best thing would be to go to your office and to visit Medicare Plus, which is one of many agents, but you in particular always come to visit us to remind us about the period. Where can they reach you, or where can they go to visit with y'all?
Well, we're on Montana between Piedras and Cotton. Really, the best thing that we can offer you is the information. And what we want is that people are taking informed decisions. You don't need to enroll. You don't need to do anything except just get the information. We invite you to go visit. We can review the benefits. And if you're in the right plan, it's perfect. Or sometimes it's just to remind you of the changes for your plan the next year.
This is a short interview, but definitely give them a call because you really need to review your plans at this time.
My name is Julie Caffey Cruz, and I'm the instructor for the senior adult drawing class. I've got students that have taken this class many semesters, and some that are brand new to the class. But we start out the class teaching the art elements. There's seven art elements, and they're kind of the building blocks of drawing, and then the drawing leads you into painting and other types of art. And then we go into drawing still life, which is what they're doing today. So they learn to draw from real life as opposed to drawing from a photograph, which changes the image to a two-dimensional plane. And then towards the end of the class, we learn how to draw the features and the face, and we touch on drawing the human form.
I've always loved to draw churches. Everywhere I travel, I take pictures of churches, but I just do a simple, I just started simple, and I just wanted to elaborate and start making nicer churches. So that's why I took class in the first place. I've been here this is about the 5th semester. Yeah, so you see, I enjoy it, and it's therapy.
The important thing, I used to draw stick figures, and then the person may say, but I don't know how to draw. The thing is that if the person has a lot of initiative and persistence, they can learn anything. And as a result of some of my work, I don't think I'm a professional artist. I'm still learning, and I'm having a blast in this class.